So someone's asking if I spoke a little bit about potassium. So yeah, potassium is going to be what's produced in terms of increased activity of the sodium potassium pumps. So if we increase the rate of action potentials, if we increase the amount of potassium that's pumped out from that sodium potassium pump. Okay. All right. Now what we're going to speak about now, let's see here. What we're going to speak about now is how do we control that blood flow? So we kind of know the general way that we control it, right? We simply manipulate the state of the smooth muscle that's lining the arteriole. We simply either vasoconstrict or vasodilate. But what are some of the ways that we can actually control that flow in terms of intrinsic levels? And then later on, we'll talk about some extrinsic ways that we can control flow as well. So there are three mechanisms of increasing blood flow to our tissues. The first one is called active hyperemia. Active hyperemia. And so active hyperemia is increasing the amount of flow that's coming into an organ or organ tissue because of increased metabolic activity. It's going to be in a response to increased metabolic activity. This is a really important part of understanding active hyperemia, is that the tissues are demanding more flow. They're demanding more oxygen, they're building up carbon dioxide, and so we need to clear that out. And so it's a response to what the tissue metabolic activity level is. And so we can think about tissues being at steady state, and when they're at steady state, the amount of oxygen being delivered is being consumed just as rapidly as the amount of carbon dioxide being removed. And so oxygen delivery is matching carbon dioxide production perfectly, okay? That's gonna be steady state. That's where the arterioles would like to be. That's kind of the homeostasis in terms of our arterioles. Now, if we increase metabolic rate, what's gonna happen, right? We're gonna start consuming more oxygen faster than it can be delivered. We're gonna start producing more CO2 faster than it can be removed. Okay, that's going to cause depletion in oxygen levels, as well as an excess in carbon dioxide levels. And so that's going to be the indicator to increase flow that's coming to the organs and organ tissues. And so the response of low oxygen levels, which means that oxygen has been depleted in these tissues, and high CO2, which means that we have a buildup of these metabolites at the tissue level, is going to be vasodilation. And that makes perfect sense. That's going to bring in more flow. And I really want to drive home the point that the flow is not just to bring more oxygen, but to remove the carbon dioxide that's building up as well. So it's kind of a twofold purpose of increasing that flow. The second, here's a schematic of actually showing this as well. So in our nice steady state basically we have a match in terms of oxygen production and consumption and carbon dioxide production and consumption. So oxygen is being produced and brought to the tissues just as fast as it is being used. And same for carbon dioxide. Carbon dioxide is being produced just as fast as it is being cleared away from the system, okay? That's steady state, that's where we like to be. Now on the right here, the schematic B, we see a mismatch of this. We see a buildup in the metabolites. So we see a buildup in the green dots, which are indicating CO2. And so because we see this buildup in metabolites, this is an indicator that we need to increase the flow to this tissue. So we simply increase the flow by vasodilating the tissues. That's going to bring more blood to this organ system or to this tissue. And that is going to remove excess carbon dioxide as well as deliver more oxygen to meet the demand of those increased metabolic activity of the tissues. Okay. So I'm seeing a question here, would the increased metabolic rate part of that be what is happening during exercise? Yes, exactly correct. So we'll talk a little bit about exercise coming up, but this is exactly what's happening. As muscles need more oxygen and produce more CO2 and lactic acid and potassium, we're going to see those metabolites build up. We're going to see the oxygen being depleted. That's going to be an indicator to vasodilate arterioles to the muscles, and that's going to help clear away those metabolites and bring in fresh oxygen, okay? So that's kind of the basis. I'm glad you made that connection. That's kind of the basis between why we say that exercise increases blood flow, increases perfusion to organs and organ systems and tissues. And this is why, because it increases the metabolic activity, it produces more flow, which will help to correct those the imbalance between those local factors. Okay. The second intrinsic mechanism is called reactive hyperemia. Reactive hyperemia. And so this is very similar to active hyperemia. It's going to be an increased blood flow in response to a reduction in blood flow. So the mechanism is pretty much the exact same. The outcome is pretty much the exact same. The cause is where we see the difference. So the cause of reactive hyperemia and the cause of active hyperemia are different, but the mechanism and the overall outcome are the exact same, okay? And as I kind of go on here, that'll make a little bit more sense. So basically in reactive hyperemia, we see a blockage of flow to tissues. Okay, whether it be impedance to a flow, whether it be a clot, whether it be maybe an injury to a vessel, so there's bleeding, but something interrupts the flow to these tissues. It's not an increase in demand. An increase in demand is the cause of active hyperemia. A blockage or impediment or some type of restriction of flow is the initial cause for reactive hyperemia. But then again, as I said, the mechanism and the corrective response are the exact same. What's going to happen if you block a blood vessel or if you have a temporary blockage to that vessel, when it is released, we're then going to see the exact same mechanism. We're going to see vasodilation, we're going to see increased flow, we're going to see that resistance decrease because of that vasodilation, and that is going to be in the attempt to remove the metabolites and to deliver more oxygen. Okay, this is something that I see students have a little bit of difficulty with, is really fine-tuning the difference between active hyperemia and reactive hyperemia. Okay. All right, let's look at this flow chart here. So basically, let's walk through the difference between these two intrinsic mechanisms of control. So basically, we start off differently, right? Remember I said that the cause of these two mechanisms are where the difference lies. So we see that in active hyperemia, tissues are requiring more oxygen. I want you to think about an example here as someone very nicely brought up, exercise, right? If you're running or jogging, or even if you're running away, if you're using your skeletal muscles more, you're going to increase the metabolic rate of those muscles. That's going to require more oxygen consumption and more CO2 production. The cause, on the other hand, for reactive hyperemia is going to be some type of blockage to the blood flow. Okay, think about bleeding, think about, compressing a vessel, think about injury to a vessel, some type of blockage or impediment to flow or restriction even to flow. And then from here on, the processes are the exact same. So because of these two different causes, we see a drop in oxygen concentration, which means that oxygen is now depleted. We see a raise in CO2 concentration, which means that we're now building up these metabolites. And we're only mentioning CO2 here, but I want you to be thinking in your mind, lactic acid buildup, potassium buildup, some of those other metabolites that we mentioned earlier as well. So we have buildup of those metabolites, including CO2, and then the response to that at the local level is going to be for the smooth muscle in those arterial beds to then vasodilate by simply relaxing the state of that smooth muscle. That is going to decrease resistance or increase the flow, okay? So increased vasodilation decreases the resistance or the impediment or the blockage to flow, and that will obviously increase the flow to these tissues. And so that's going to result in more oxygen being delivered to these tissues, more CO2 being removed, and again, other metabolites being removed as well. And then we want to turn the signal off. And so when the oxygen levels are replenished, when CO2 is removed, when we have brought the tissues back to steady state, where we have that matching of oxygen production and consumption, likewise for CO2, we can then turn this signal off. Remember that negative feedback loop, that idea that when homeostasis has been completed, we turn this this system off, and that's going to bring the arterioles back to their original shape, back to that original tone that we talked about at the beginning. Okay.
What would happen if vasodilation didn't vasodilation didn't happen? What would happen to your body?
That's a really good question. If we didn't have the ability to vasodilate, you could have necrosis, you can have ischemia, you can have death to the tissues because of the buildup of those metabolites and because of the lack of oxygen. So tissue death is ultimately the result if you don't have enough vasodilation. Yep. Any other questions? That was a good question. Any other questions? Okay. And then the third response, the third mechanism that we see for intrinsic control is called the myogenic response. And this is basically this inherent property of arterioles to basically constrict anytime they're stretched beyond their original shape. So it's basically a change in vascular resistance that happens in response to an original stretch of that blood vessel, okay? It's going to be, again, absent any external factor. So just to backtrack here and remind ourselves, active hyperemia, reactive hyperemia, and the myogenic response, these are all local levels or intrinsic levels of controlling flow to a tissue or to an organ. Right? This is happening at the tissue level. This is not requiring any hormones or any neurons or neurotransmitters or any external stimulus. And so these are going to be that's what we mean when we talk about these intrinsic controls or these local controls. Okay. And so this third mechanism here, the myogenic response, it's the way that the blood vessel kind of auto-regulates its own flow. It's a way to kind of protect itself from excess flow as well. And so the response is that if you increase perfusion or increase the amount of pressure that's coming in to these arterioles, you're going to slightly stretch the arteriole to some degree. And the natural inherent response of arterioles when they are slightly stretched is to constrict. Okay, and so that's going to be what we see whenever there's increased flow to an arteriole. The natural inherent response is to vasoconstrict. So it's a vasoconstriction in response to an initial vasodilation because of increased flow. And what this does is it basically decreases the flow, which helps to regulate how much blood is coming into that arteriole. The purpose of this is to protect the arterioles, to protect them from excess flow and to keep the amount of flow constant, and in some ways to kind of auto-regulate how much flow is coming in. And one example that I like to give, it's a little bit extreme, but think about you just pumping blood into your system. Let's say you had an IV hooked up and you were just pumping a lot of blood into your vasculature. If our arterioles did not have this ability to regulate their flow, they would just expand and expand and expand and expand indefinitely. And this would obviously be injurious, right? This would be harmful in terms of the walls of those vessels. And so this myogenic response is not only regulating flow, but it's really protecting the vessel. So anytime you have vasodilation, which stretches on the arterial wall, the natural response is going to be to vasoconstrict. And so that's another way that we can regulate flow that's coming into our organ tissues. Okay, so here's a schematic that represents or kind of walks us through that mechanism. So we've got an arteriole, we increase the perfusion pressure. And actually, let me stop here and kind of talk about perfusion pressure a little bit. So this is another way to express mean arterial pressure. So don't be confused when you may see different terms to express this idea. So mean arterial pressure, perfusion pressure, these are synonymous with what we've been talking about. So think about bulk flow, think about cardiac output. They're the same general idea. What is the driving force that's moving blood through our circulatory system, okay? So perfusion pressure is not a new idea. It's the same thing that we've been talking about, that mean arterial pressure, that pressure gradient, that driving force. And so if that increases, we're going to increase flow, okay? And the increasing flow to our arterioles is going to stretch on the arteriole smooth muscle. that is going to have an automatic inherent response from the arteriole to then increase their rate of constriction, which will increase the amount of resistance, and that will be what decreases the flow, and that can be a protective mechanism, a regulatory mechanism for the amount of flow that's coming into the arterioles, okay? All right. Okay, I'm going to pause here and see what questions we have about that so far. So we talked about the 3 intrinsic mechanisms of regulating the flow through our arterioles. We talked about active hyperemia, reactive hyperemia, and then the myogenic response. Okay, let's talk now about how exercise, and I'm glad someone brought this up earlier. It's a really great example for how this happens. But how exercise pretty much is also regulating flow as well. So when we're exercising, and you can also think about the fight or flight response, running from a threat or fighting or fleeing, the cardiac output increases, okay? But the distribution of that blood is not proportionally increased. In other words, when I am running or jogging, my cardiac output is going to increase 4 to 5 times fold, depending on how vigorous that activity is. But all of my organs, all of my organ systems and tissues are not going to get that increased cardiac output equally. Okay, we're going to see dilation to vessels that are more important for those functions. Think about skeletal muscle, think about heart, think about skin even in terms of cooling the system and releasing heat. Those systems specifically are going to be vasodilated. That's going to move more blood towards those organs and organ systems, the muscle, the heart, the skin. Whereas kind of everywhere else, but mainly the GI tract, the kidneys, we're going to see decreased blood flow to these organs, okay? And that kind of makes sense, right? When you think about the connection here with the autonomic nervous system, the fight or flight response, if I'm fleeing from a threat, blood flow to my GI tract is a little bit counterproductive. It's not efficient. It's not needed at that time. What's more important is getting enough of that increased cardiac output shunted or going towards my skeletal muscles, towards my heart. Now, there's one really, really important exception to this rule. Can anyone predict which organ system would be kind of exempt from this general rule? So let me kind of rephrase that. So we see that if we're exercising or increasing our metabolic demand, increasing cardiac output, that cardiac output is not going to be distributed evenly. It's going to go more to skeletal muscle, more to heart, and most of our other vessels, including the GI and the kidneys, are going to pretty much sacrifice their blood supply for the sake of the skeletal muscle and the heart. Which organ system do you think cannot sacrifice its blood flow, its cardiac output?
Would it be the brain?
Excellent, thank you. So yes, the brain. So the brain is exempt from this rule. I always mention the brain as being selfish. It does not sacrifice its blood flow. In fact, it increases its blood flow. And so even while we're fighting, fighting, fleeing, exercising, and we're shunting blood from other organs and towards the vital organs at that time, the brain never sacrifices its flow. So it's exempt from this rule. And so the brain usually always protects or conserves its flow, okay? Let's look at the schematic here. So when we're at rest, cardiac output is about 5 liters per minute. And so if we look at the distribution of that 5 liters per minute, we've got about 1 liter going to skeletal muscles, about 1 liter going to kidneys, about 1.25 liters going to the GI tract. So slightly more to the GI, which we can appreciate, right? Remember that rest and digest. And then we've got about 0.2 liters going to the heart, 0.7 to the brain, and then others 0.6. We can contrast that to exercise. So when we're exercising, we're under the influence of the sympathetic nervous system. We see that the skeletal muscle gets 20 liters of that increased cardiac output. So the overall cardiac output has also increased 5-fold to about 25 liters per minute, but the skeletal muscle gets the large chunk of that cardiac output, that increased cardiac output. If we look at the other, the distribution of the other organ systems, the kidneys get less, the GI tract gets less, the heart gets more. Right? Remember, the heart is an important part of exercise and increasing that cardiac output. So it's going to obviously get more. The brain is going to get more, right? Being selfish as it is, it's going to require more to, and this is not just to send blood to the brain. I kind of want to explain why the brain is like this. That's because even in states of fight or flight, we need to be thinking, right? We need blood to be going to the brain so that we can make decisions, so that we can perceive the world around us. And so it's not efficient, it's not wise for the overall protection of the organism to shunt blood away from the brain. And so although I'm just saying that the brain is being selfish, we want to kind of understand why that is in the overall best interest of the organism, okay? And then we also see that the skin gets slightly more flow as well from that increased cardiac output, which is a part of shunting blood towards the limbs, and then also part of losing heat in terms of that excess heat production.